So when I digitally pushed over here, I could feel the bones move back over, and now I can see that her nose is more, or is exactly where it's supposed to be. I can palpate on both sides just to confirm. And then what I'll do, so I'll take this packing out. Take this packing out too. Alright, so we're gonna get underneath this thing, give it a wiggle, and just deliver this thing. Look at that. Crazy little lump of love right there. On the top, we got a couple of loose teeth there on the top. And I don't know if you can get a feel for this, but the tissue is very boggy. It's very loose and very purple. So we're going to do a biopsy on the top, biopsy on the bottom, and we're going to take out those 5 teeth. This is the biopsy from the lower right-hand side. You can see that this tooth came out with a chunk of tissue just attached to it. And this is our biopsy tissue as well that we took out. And then from the top right-hand side, this is our tissue. Just showing that. And we'll send this off and we'll see. I will be very surprised if this is not either lymphoma or metastatic testicular cancer. Lip shave, vermilionectomy, I guess is the other term for it. And then I raise up this little flap on the inside with the buccal mucosa and use a laser for hemostasis, just so that we can advance this tissue forward and close this back over. So that'll be the next step. And I'll use some 4-Vicryl for deep sutures and then 5-0 nylon for skin. So we'll come back in a bit and it'll be all stitched up.
Yeah, I use that every day. I put like a little
extra triangle takes longer than the actual procedure.
Another hand there. Oh my. Wire cutters are getting a B-. So clipping the wires first. Bad boys out. Before you know it, the arch bar comes out. And that is how you remove the arch bar. This will all heal and go back to normal, but the gums are definitely not happy about having metal through them for several weeks. We'll get the bottom out and take a post-operative radiograph to make sure that there's no retained wires or foreign bodies.
%70 overall drop in opioid use. And with the proper understanding and use of Exparel, you too can see the success that Exparel will bring to your clinic. Dr. McClelland, DDS, has been using it in his clinic for a few years now, and he's seen great success in his patients and their pain management every day. In this 6-video series, you get a professional masterclass that will give you the jump start you need to include Exparel in your daily routine. It includes a bonus PDF with a patient information handout, post-op medical instructions, and a quick look sheet for the materials and supplies for explaining Exparel. Go to teachable.com today and get educated on a non-opioid anesthetic that will help your patients have a better day.